Welcome to our series of interviews where we sit down with top leaders in healthcare IT. My name is John Lynn. I'm the founder of healthcarescene.com, a network of leading healthcare IT resources. Check it out at healthcarescene.com. Before we begin with our interview today, we want to really recognize and thank our sponsor, Intel. They're sponsoring this interview about genomic medicine and precision medicine, but they're also sponsoring a number of videos we're going to be doing at Healthcare Scene. So thanks to Intel. They're the processing power behind much of what we're going to talk about today. So thank you so much, Intel.
Cancer is the word that no patient wants to hear. And for more than 50 years, treatment for every patient was one size fits all. But now, that's changing. By sequencing cancer patient genomes, doctors are identifying defects in cancer genes. And they're developing targeted therapies that strike the cancer like a silver bullet, while leaving the healthy cells unharmed. For some cancers, patients have up to 6 times better response rates to these new treatments. But because they're still new, many doctors either aren't aware of them or don't yet have the technologies required to deliver them. So Intel and Kaijin are working to give cancer doctors and laboratories the tools and technologies they need to democratize these powerful new treatments. Sequencing the first human genome took 13 years and cost $2.7 billion. Soon, it will cost as little as $100, making it more accessible. But gaining insights from the enormous amount of data generated is still a challenge. Those genomic results must be analyzed and interpreted. Running on Intel processors, the Kaijin Clinical Insight platform translates raw genomic data into actionable insights that help diagnostic labs and doctors find the most promising treatment for each patient. This gives doctors a comprehensive assessment of a patient's genetic profile and identifies targeted therapies and clinical trials the patient may be eligible for. Less than 3 to 5% of oncology patients are aware of clinical trials and investigative drugs they may benefit from. Now this potentially life-saving information can be available to them. The Kaijin Clinical Insights platform is an incredibly powerful new tool that's helping make precision medicine a reality, and it's powered by Intel technology. The future is turning cancer into just an ordinary word. It's becoming just another disease, and this is just the beginning. We know the future, because we're building it.
All right, our special guest today is David Chou. He's the Vice President and Chief Information and Digital Officer. I know he likes that idea, Chief Digital Officer rather than CIO, at Children's Mercy, Kansas City. Welcome, David.
Thanks, John. Thanks for having me, and thanks, Intel, for making this happen. I'm glad to have a discussion with you today and have a good discussion about precision medicine and what's going on in that world. So hopefully I'll be able to share some good insights for everyone that's watching.
Excellent. And if you don't know David, you should check him out on Twitter. He shares incredible info. You can see it at dchow1107, which maybe we need to figure out one day what that number is, but it feels like an AOL site, but maybe. But anyway, check him out, dchow1107 on Twitter. He shares amazing stuff. But tell us a little bit about yourself, David, and the work you're doing and your history in healthcare.
Yeah, so a little bit of background. I've been at Children's Mercy for about a year now, so I'll be celebrating my 1-year anniversary in Kansas City. Prior to that, I was a CIO at the University of Mississippi Medical Center, the state's only academic medical center. And before that, I had some international stint with the Cleveland Clinic in Abu Dhabi, where we're building a flagship startup hospital. And I started my career primarily in the for-profit healthcare systems in Southern California. So travel around the world the last 7 years and still loving this journey so far in healthcare IT, especially during this time to where technology is such a focal point, and it could really be a competitive advantage for every organization if they're approaching with that methodology and philosophy.
Excellent. Well, you have such a diverse background across the world, even. So tell us, what's the CIO's perspective on these things we call precision medicine and genomics? What's your take on it?
So it is, if you think about, precision medicine, you're really just talking about customizing the care for the patient. So let's step outside the healthcare world now. Let's just talk about the retail world, because everyone can relate to how we live in the retail world. If you think about how we get sold and how we make decisions, then how do we react? A lot of things are personalized to us from a retail perspective. So when we think about healthcare, we have not really moved towards that personalized care yet. and we're starting to get there. And that's where the fundamental principles of precision medicine comes in. The genomics, things of that nature, those are great tools, and that's a tool that can help you get to precision medicine. But when I just describe precision medicine in a very simplistic term, it's really about providing customized care and trying to predict a outcome that may potentially happen or maybe not happen.
Well, and it's interesting you describe genomics as a tool, whereas the precision medicine is maybe using that tool to provide the care, because those genomic markers should make it even more personalized than we could even really dream about today. It almost feels like.
Yeah, no, I definitely agree. And when you look at the cost curve of genomic testing right now, it's the same cost curve as storage for computers, right? The cost curve is moving down, it's a downward trend. It's almost at the point of, the first one that gets to zero gets the business. It's almost going to be a commodity soon. And that's where I see that genomics going to play long term. We're not there yet, but I do see that trend. And yes, it is a great tool. And when you think about precision medicine from a physician point of view, just if I have to put on the physician hat, they did not go to school to get their sort of diagnosis from a computer. They went to school because practicing medicine is also an art, comes with experiences. So there are a lot of things that genomics and these technology tools may be a guide, but it won't be the end all be all. And I think that's where you're going to see the other end of the spectrum when you have the counter arguments against precision medicine. But overall, it's a great thing to start working towards. And from a CIO seat, how do you prepare an organization towards that? That's the challenge, because there's a lot of steps that need to happen before we can really put together a infrastructure and a foundation to get to precision medicine.
So what are the things you need to do to prepare your organization for that change? Because you're right, it is a bit of a sea change in how they practice today. So what are some practical things that CIOs can do to prepare their organization for this shift to genomic medicine, precision medicine?
I would start with, you need to look at your fundamental infrastructure, your core technology component that your organization is using. You're going to have to build a lot of technology. So for a lot of, I'll call it legacy CIOs, that's where they have made their career, building technology. And that's a component that's required. No matter what you do, we got to build that core foundation, whether it's on-premise or using cloud platform. You have to have a strategy of where that platform is going to look like. And secondly, on a really high level, you need to transform the organization to be data-driven. I know that's a buzzword out there. Everyone wants to be a data-driven organization, but if you think about the fact that every organization probably has a lot of different silos in terms of data repository, data sources, how do you gather that into a source of truth that that the organization and the users can believe? And then when you have those components set, I think that's when you'd be ready to talk about precision medicine. You can utilize the data to make decisions, or even put data into some sort of analytics engine to come predict some sort of outcome. But before you get to that stage, those are the two fundamental building blocks: is getting some sort of data strategy and governance model in place, along with your core technology infrastructure to support this vision of a data-driven.
That's interesting. I mean, I think it is important to have that core structure, and I think it's also the trust of the data. If you don't trust the data, then no one's going to trust the precision medicine outputs that are being provided to you by the system. So I think it's, that there's a trust component, but then also the infrastructure to deliver that data, to process that data, to understand that data. And many organizations are, like you said, legacy CIOs that really want to put in the infrastructure, but don't necessarily want to understand how to push it down to the point of care.
Yeah, a lot of it's governance too. As much as I would hate to say it, a lot of it revolves around how do you put together the right governance model. Every organization is unique. This is about how do you operationalize this culture towards precision medicine, because the tools are out there, right? People have solutions that they are selling and saying this is what is going to get you to precision medicine, but no one's helping any organization figure out how do they move the culture.
Your points are right. You need the infrastructure, but the governance matters as well, because if you don't have the wrong governance in place, then you'll never see the results that you want to achieve. Jeremy Coleman chimed in. He said that in the chat that precision medicine will require a new level of supply chain management, which I think is another element we forget about, right? It's like, okay, well, if we provide them all these tools and this data, how are we going to also provide them with the right resources to be able to treat, the patient the way that they need to be treated?
Exactly. And people's job roles and job description actually changes a lot when you start moving towards this model. So this has to be a model that the organization has bought in. You could start with the institute, you could start with the department, but ultimately it has to be you're practicing a new way of approach in terms of medicine. So it is not, I would say, technology can be a really good tool to help us get there, and it'll probably be a central focal point, but buying the technology does not mean you get the precision medicine culture or a data-driven culture right away.
Yep, definitely. So, tell us, I think a lot of people are sitting there wondering, what are some practical things that are really happening today, either in your organization, or I know you talk to lots of CIOs, where are you seeing this precision medicine and genomic medicine really happening today as a reality?
Yeah, so Children's University of Kansas City has a big genomics center. We're really proud that we're probably one of the few early adopters in the pediatric world of having a genomics center. So, we're using the center for research perspective. We're working closely with clinical trials, NHS, in terms of figuring out how can we improve the care for the kids with this data set that we have in the Genome Center. We have a few big partners like our EMR vendor who wants to partner with us to figure out is there something that we could collaborate there. So when I think about what organizations are doing, everyone's doing something in terms of providing that personalized care. Now, that something may be as small as just modifying various care plans within the organization, or it could be something huge where you're utilizing technology from Intel, from IBM, from other vendors out there to predict outcomes. So I see a really broad spectrum of organization. The one gap that I really do see is who is trying to lead this charge when we talk about precision medicine. Should it be led by a clinician? Is a technology mission? So I've seen a lot of sort of organizational rub when it comes to the leader of precision medicine, where it's being led by a medical staff who's clinically savvy, and then they're buying all kinds of technology, but these technology may not be sort of best practice. So that's something that we need to be cautious of from any C-level suite, regardless of your role, whether you're a CIO or a Chief Innovation Officer. There's something we have to work towards in terms of collaboration. But so I'm seeing a various spectrum, things, as I mentioned, just simple stuff from a precision medicine standpoint, or all the way up to technology advanced institutions.
Mm-hmm. So who should really lead these type of efforts? Or, I mean, you described it should be a collaboration, but there's always a leader, right? Even if it's a collaboration. So, what should be the governance structure and leadership structure there?
So this is where I've seen other industry pivot extremely quick. Healthcare still lagging on. If you have a traditional CIO, probably not the right player. That's when you start moving towards a chief innovation officer. You may have a chief nursing officer that's driving it, or some organization that I'm really starting to see that chief digital officer come in play, to where they're that intermediary between core technology and what's going on operationally, whether clinically or from a business system standpoint. So that question really depends on the organizational culture. I would say, to make it simple, it's whoever can influence decisions easily. So obviously there's not going to be a chief influencer officer role, but there's got to be someone that can influence decision and be able to understand technology as well as the business aspect of it.
So we kind of talked about some of the stuff's happening today, but use your crystal ball, rub your crystal ball and kind of look into the future. Where do you see this all headed? And what do organizations and hospital CIOs in particular need to know about where this is headed? So paint a picture of what the future is going to look like 5, 10, even 20 years down the road.
The next 5 years, I see us just painting the foundational element, getting more towards a data-driven organization. Hopefully, in about 10 years, we're going to see a lot more automation from a medicine perspective. So don't be surprised if there's going to be some sort of a computer or a bot that's going to respond to your first line of care. That's where I see the trend towards. So, I mean, simple stuff. I mean, they won't be able to perform surgery, but simple stuff, being able to do an analysis on whether you need a certain antibiotics based on your condition. That should not have to come from a doctor in the future anymore. That may be coming from a bot. So as that evolution evolves, it's going to change tremendously how we practice medicine. And I know a lot of internal medicine folks may hate that example because they didn't go to medical school to get replaced by robots. But if I was in their shoes, I would try to pivot and figure out how can they utilize that information to do something different or even something more so they could practice at the top of their license. So I do see that trend coming. And 20 years, who knows, right? We may never see a doctor unless it's surgery. And even with the surgery, a lot of times, even right now as we speak, surgeries can be performed by robots. You have a doctor in Europe, patient in the US, and they're using robotics that's being controlled in Europe to perform a surgery. That's already out there. So I see lots of automation. I see use of technology adoption growing as we're trying to decrease costs and work towards providing the highest level of efficiency in healthcare.
I find your comment about automation really interesting because in order to automate things, you really have to understand the patient at a very detailed and specific level. So, I mean, we really need precision medicine tools to reach a point where we can automate. Right now, they really are a supplement to the doctor. But I think, that's one baby step towards automation that lets us do it. And to your point, a lot of doctors are afraid of what that means. But, a lot of doctors that see it, they're like, wait, so you're saying I don't have to diagnose the common cold or, an ear infection anymore ever again? They would all rejoice for the most part, right? So,
right.
So I think there's a mix of the two.
Yeah, if you just, I mean, this may not be a good analogy, but if you look at how I operate right now in terms of just my daily schedule, 3 years ago, I probably would have an executive assistant that's helping me do my calendar, schedule meetings. Now I'm using automation. I'm using a robot. My EA is actually doing project management work. So think about that evolution to where I'm trying to automate function and getting people to operate at a higher caliber. So definitely that will happen in the healthcare and the medical world to where computer technology, robotics, it's going to really help and increase that level of automation.
Mm-hmm. Well, and I think it's a powerful idea of being able to automate a lot of it, both from the patient perspective. I think it scares some people because of ensuring the quality of care. But, I think it will likely be better than a human who has frailties and inconsistencies in many cases. But the real question, I think, when you start talking about all this automation, all of this ability to really precisely treat the patient using a massive data, when I think about that, I think about some of the rural hospitals or the smaller hospitals or small, against the large health systems that might be able to afford to invest in all of this data. I mean, you're a children's hospital, which, by definition can only be so large, right? So, are the smaller players going to be able to participate in this type of precision medicine and eventually automation, or are they going to get shut out and the big players that own the data are going to be the ones that rule healthcare?
Yeah, that's a very good example. So if you look at the trend in terms of number of hospital beds in the U.S., it is declining. So what does that trend tell you? The consolidation is happening, whether you want to admit it or not. It's happening all the time. There's not one day where I could pick up the news and not see a company like CHS selling hospitals and someone acquiring hospitals. So there's a big shuffle right now in terms of healthcare, hospital management in general. Where I do see the rural hospital is they will have to partner with someone. There's no way they could run as a standalone. So that trend is starting to happen where you're seeing a lot of partnership and affiliation. So hopefully with that trend, as that trend continues, what you will see is the bigger players utilizing their buying capabilities and their technology components and thinking about it, you having a shared structure for the rural hospital. So I foresee that happening, and that trend will definitely continue. So there's, unless some major breakthrough happens where reimbursement model is just so great to where people can act freely and act on their own, I don't see that happening. So I do see consolidation happening all the time, especially for the rural hospitals. So there are some challenges there, but if you think about the way, even from an EMR perspective, because people like to use EMR as an example, there's a lot of EMR consolidation even happening where rural hospitals can't afford the luxury of buying $100 million system. So what are they doing? They're partnering or they're filling in with a bigger system. In return, they're getting the EMR application platform. So definitely that trend will continue, and that trend will probably impact other areas of technology, potentially like the precision medicine, possibly genomics.
Mm-hmm. And I think that's an interesting comparison to the EHR, because I think one challenge, and maybe this is a question for you, do you think this type of precision care and genomic medicine is going to become a standard of care where you literally can't practice medicine without it? And, so then you have to partner with the big boys. It seems like that's a logical step. Do you see that happening, or do you have a different perspective?
No, I definitely see that happening. I mean, it goes back to what I said earlier regarding the foundation that you need for precision medicine. You need the infrastructure and you need data. So in order to be good at this, you gotta be able to mass a lot of data. So if you're a single instance hospital, you don't have a lot of data. So how do you collaborate? How do you create that cohort? You'd have to partner or build some sort of affiliation so you can gather that massive amount of data so that you can start figuring out how do you practice medicine and be data driven. So definitely that trend will continue, and hopefully the reality is that I hope in my lifetime I want to see it get to true interoperability to where we could mass the entire amount of data wealth in the U.S. and be able to practice medicine. And that's where I really think you get to precision medicine, because without that data source and that massive amount of data, you won't be able to. You don't have enough information to make a judgment call from an automated fashion.
And we think we have a mass amount of data, and we're just starting to sequence our genome, right? It's like,
yeah. I mean, you just look at my spend on storage from a genomic standpoint, it is growing exponentially. So the amount of data is growing. Obviously, people always say storage is cheap. Yes, it's cheaper, but the amount of stuff we want to store just grows astronomically. So, from just a core infrastructure standpoint, I have a decision to make. Do I store this thing here, or do I move it off to the cloud? Do I partner? A lot of organizations will have to start wrestling with that problem as they're starting to move towards a data-driven precision medicine model.
Mm-hmm. No, it's funny. Not funny. It's kind of sad, actually. But you're growing it exponentially. The data costs, while the data storage is exponentially going the other direction, which means what? That's 2 orders of magnitude quicker growth, right? Because you're getting all the cost benefits, but you're spending even more. So that's an illustration of how much data is being processed.
Exactly.
Yeah. So, if you look across, what you're doing, what you see happening in the industry, what's the most exciting thing you see happening in precision medicine, genomic medicine, that you really want to capitalize on in this next year to really make an impact for your patients?
In our organization, I'm really excited when I see our researchers utilizing our genomic center for data and being able to make an assessment and some sort of analysis based on the output of that data from the genome center. So being able to use genomic sequencing to care for a kid or to redirect the treatment based upon that test, that's really powerful. We've seen a lot of use cases to where our cardiologists are using this data and then based upon that data, they're diverting their care plan. They change it completely based upon that data. And that's what we need to happen, right? That you have a different type of information or that's going to change your assessment. And sometimes we save the kid life because of that. So as that continues, as we see more and more examples of that, that's what really excites me. That's why we're in the profession of saving people's lives. The reality is the financial sector pays a lot more than healthcare. So the mission of healthcare is what drives a lot of people in this vertical. So being able to see that we could utilize this information to to save a kid's life, that's really powerful. And we hear about those kind of stories all the time as a result of us having a genome center, as a result of us having researchers that collaborate with others and thinking differently and sharing data. So that's what we're moving towards, and that's really exciting for me to see. And that's what keeps me going.
Yeah. Now I took a tour of TGen down in Phoenix, Arizona, and just some incredible stuff. And their ability to take like the genomic sequence of someone with a rare condition that every doctor said, we don't know what to do with you, we don't know how to treat you, and then used their genomic sequence to identify, I forget what it was, if it was an epileptic drug or some other drug that doesn't relate to their cancer at all. They found this drug that somehow influenced that specific gene that was off. They started using it and the cancer just started disappearing. It was just extraordinary to see the impact. And it was on a kid too, right? Which is often the case, that they're able to treat it. It's such a powerful part of the story.
Yeah, so that's, hopefully we see that trend continue.
So when you talk about being able to help the patients the best way possible and impact those patients, when I look at it, it seems like, you really have a challenge of trying to do it all in-house, sharing with other people. And I think that, that's where the cloud is so powerful, is because it can enable every hospital to have access to all of the genomic medicine, the precision medicine, all of the data, all of the insights from that data that's available. And Manish Sharma, who's watching live, he asked the question, is the storage better on the cloud or on premise? What's your approach to kind of balancing those two? I think we all would love to be in the cloud, but then that gets kind of expensive when you're storing so much data. But then at what point can you just not store it locally? What's your approach to those two options?
I mean, that's a perfect example of where people want to tell you cloud is cheaper. It's not cheaper. You get to a scale to where it is not cheaper and it is more cost effective for you to build it on premise. The benefit that you gain in a cloud environment is you have a service. You're paying for a service that's going to do the backup. They're going to make sure the infrastructure is secure. So they're doing all the legwork that you may not need to do as a luxury on premise. So there is a point to where it is definitely not cheaper, I would say, for a large scale health system. That's always the challenge of, do you want to keep that traditional data center and build it, or do you want to utilize a cloud model? So it's always a hybrid. Right now, currently, our Genomic Center is on premise. We are exploring cloud options. We are maybe possibly just from a backup perspective, but right now everything is still on premise because it is more cost effective. But at the same time, we're understanding that we need to start thinking about utilizing cloud services for storage and even high compute. You pay for the computation of these genome sequencing on a consumption base, so you only pay when you use it. Whereas if you're building something on premise, you're assuming that you're going to be at that maximum scale 80% of the time. So it is a very different approach, and you do need to weigh the pros and cons. And the message I would never sell to anyone is going cloud is cheaper. It is just more efficient. So there's a cost for that efficiency, and that's where you need to justify going that route. But it is my preferred route for everything.
And I'm interested to see if that evolves where we're storing so much data. And if you look at it, if this is all of your data in any one given day, you might only need 10% of that data. So I wonder if these cloud models will evolve to the point where, it is more cost effective to use because, this 90% is just in storage that costs them, as you scale, it approaches nothing, right? So, from a cloud provider perspective. So could they create a model that actually works with us with what we're using as opposed to what we're storing? I'm interested to see if those things evolve.
Yeah, that would be interesting, where you pay a fixed fee for storage and then you pay a consumption charge. That's a very unique model. I don't think people are thinking about it, but right now it's the first wave to where these vendors will want you to get into a cloud storage. And that really locks you in. The transition from one cloud to another is very difficult. So once you're in, you're locked in. And then maybe they may think about the approach of some sort of consumption model, which will make sense.
Interesting. So, let's wrap this up with kind of the final question. What would you say to someone who thinks that precision medicine is all hype, no substance, right? It's not really happening. There's a lot of talk, not much action. What would you say to the skeptic of precision medicine?
What I would say is it's what the patients want. We want a personalized care. So it's not about whether a medical profession thinks it's hype or not. The demand will be there. So if you're not meeting the needs of the demand, people have options these days. They could fly halfway around the world to see a medical staff, and maybe even cheaper. So if you're not providing that value add and meeting the needs of the customer / patient, you may not be in business anymore. So that trend will definitely continue. But I'm a big believer in using precision medicine, these tools to really tailor a care plan for a patient, and that's how we will get better. But ultimately, is what the patients want. For example, I want a specialized care plan for me versus a generic one. I want to be able to utilize these tools with data points that you can show me. Patients are smart these days. They're going to research on their own before they come see you. So you better have the valid data points to back up your action plan and how you want to treat the patient. So it will be there whether you like it or not, especially as the generation evolves, where millennials are becoming getting old and older, where they require care. That's how they grew up. So you can't change how that generation grew up in that world of data driven. So it's not going to be, unfortunately.
They may not even have to fly around the world. I mean, if it's all automated and it's all based on data, you can push the data to that robot and get the diagnosis without even going in.
Yeah.
Definitely. Well, thanks so much for spending time and sharing kind of the hospital CIO perspective on precision medicine and genomics. Thanks everyone for watching live and those watching the recorded version as well. If you like this content, check out more great health content at healthcarescene.com. And also a big thanks to our sponsor, Intel Health. Intel, check them out at Intel Health on Twitter. They're pushing out a ton of great content around precision medicine and genomic medicine. So thanks everyone for joining us, and thanks to our special guest, David Chou, Vice President and Chief Information Officer and Digital Officer at Children's Mercy, Kansas City. Thanks, David.
Thank you.